Hello, my name is Alexa Fraticangeli, and my partner Sarah Gallo and I will be discussing our case study on Michael Dowling and the COVID-19 crisis in this presentation. Michael Dowling is the president and CEO of Northwell Health and known for having a powerful voice in healthcare. He has been with Northwell Health for almost 30 years and previously served the governor, Mario Cuomo, as Chief Health and Human Services Advisor for 12 years. According to Northwell Health, he leads a clinical, academic, and research enterprise with a workforce of more than 82,000 and an annual revenue of $16.5 billion. Northwell is the largest healthcare provider and private employer in New York State, caring for more than 2 million people annually through a vast network of hospitals, outpatient centers, and urgent care facilities. Michael Dowling successfully navigated the Northwell Health System through the COVID-19 crisis as its hospitals were at the epicenter in the U.S. Since this success, Dowling has been consecutively listed as one of the most influential leaders in healthcare. Throughout Michael's years as a healthcare leader, he had been faced with many crises and challenges that followed them along the way. When faced with the COVID-19 pandemic, Michael shared that he and his team at Northwell started preparing for this crisis far before it arrived in 2020. It began with the threats of terrorism and mass destruction, which Michael then decided to pay attention to and prepare for, and this very thing came into fruition. What was then the attacks on the World Trade Center in 2001 was now what Michael was prepared to take on as the next level of mass destruction, which was the coronavirus. As Michael explained the virus, he says, "We were attacked by an enemy we could not see and didn't know a lot about it. Therefore, it was imperative for Michael and his team to look at how they could prepare for what was about to come. This preparation involved structuring an emergency preparedness plan for the Northwell Health System. With this plan in place, Michael already had a framework for how to approach the COVID-19 pandemic, while also preparing his system for how bad it was going to get. Dowling's goal with the emergency preparedness plan was to create a culture where he and his fellow leaders of each hospital within the Northwell system could provide confidence to change and improve in the midst of chaos that was about to arrive through their doors. Michael Dowling is the key decision maker in this case, as he is the leader of the Northwell Health System and the person each hospital in the system looked up to for guidance during this time of crisis. From the beginning of Michael's goal setting as a leader of such a large health system, he wanted to ensure that emergency preparedness for any outbreak to be of priority. As he likes to say, bad things will happen, we have to be ready. Dowling describes this preparedness plan with the all hazards approach. The all hazards approach prepares his health organization for any type of disaster that creates an emergency leadership unit able to deploy workers and resources from every part of the organization to wherever they are most needed. He explained that this preparation was Northwell's ultimate responsibility, and he believed practical and cultural readiness are prerequisites to the ability of healthcare professionals to coordinate efforts with other resources like first responders and the government so that no one is overwhelmed and patients can be properly cared for. To this point, Dowling's main objective was to gather workers, ensure each hospital was led accordingly, as this was an all-hands-on-deck situation. Michael also consulted with emergency management experts and had to invest millions of dollars in equipment, especially protective equipment for frontline workers and ventilators. This also involved recruiting and training a large number of healthcare workers, as New York was the epicenter of the crisis. Northwell had some of the largest volumes of patients admitted in the nation. Michael Dowling facilitated this while also protecting his own employees who were also falling ill to the coronavirus. Protecting his staff, and most especially the frontline workers, was kept at a priority for Dowling, and it was important for him to maintain their safety, as this was going to take a toll on them physically and mentally. Other important actors in support of Dowling's strategy were Governor Cuomo and his administration. With the help of the government, providing the funds and support system needed to see Michael's plan through was a key factor. Dowling had a strong relationship with Governor Cuomo, and with this relationship growing, Dowling was asked to lead in Cuomo's initiative to re-image New York in the post-COVID world and what that meant for healthcare. As the leader of this new initiative, Dowling was also a leader in support of the new COVID-19 vaccine. In fact, a Northwell employee, Sandra Lindsay, was the first person to receive the vaccine and made U.S. history. To maintain Dowling's preparedness plan was not an easy task, as Northwell's system took care of more patients with COVID than any other healthcare system in the country. Dowling had to instruct his system to find ways of doubling their capacity to upkeep with the volume, and this involved the need for more healthcare workers. Traveling nurses and respiratory therapists especially were recruited to come and work for the health system to help with the amount of admissions coming through their hospital doors. Another decision Dowling had to make to improve the workflow of the front line taking care of these patients was how to use what resources hospitals already had and redistribute them. During this time, ordering and receiving supplies for testing was scarce, so Dowling had nasal swabs 3D printed for more testing resources. He also came up with an idea to convert BiPAP machines into mechanical ventilators. This was also a scarcity, as hospitals in the New York City area were overburdened with patients that were also in need of them. Overall, Michael was grateful for the emergency preparedness he had structured into Northwell's system, as it was successful in helping him and his team make crucial decisions quickly and efficiently.
The COVID-19 pandemic was the worst public health emergency Dowling encountered in his 40 years working within the healthcare industry. Northwell's system treated more COVID-19 patients than any other healthcare system in the nation. By the end of 2021, the health systems network had treated more than 254,000 COVID patients, including 64,000 who were hospitalized. To stop the spread of the virus, the healthcare system had to handle the spike in patients and make necessary adjustments. To make room for COVID patients, all other non-emergency services were temporarily suspended, while other providers, regardless of specialty, were also asked to provide support. Concerns regarding the pandemic's effects on healthcare professionals rose along with the number of cases. In order to stop the spread of the infection, doctors and nurses had to spend months away from their families, making many sacrifices in the process. Dowling praised his team's commitment and effort as doctors and nurses continued saving lives while grieving the loss of their loved ones. Northwell Systems discovered ways to grow as cases spread across the nation by building tents and housing patients in lobbies and conference rooms. Northwell's methods were able to accomplish what initially seemed impossible. Undoubtedly, Dowling's plan for unforeseen crisis had an impact on how they were able to handle the problems brought on by the pandemic. This, however, wasn't without a cost. Northwell's hospitals had to temporarily pause all other services in order to care for the numerous COVID patients. Similar to other facilities across the nation, Northwell was impacted by shortages of personal protective equipment and other vital supplies. Some of these issues could have been further avoided if the virus's spread was stopped sooner and there was better access to easily available medical equipment.
When assessing Michael Dowling's leadership, it is important to note that by creating such a foundation of togetherness and a culture of care and perseverance in the Northwell system, Dowling was able to count on his frontline workers in an extraordinary way. He explained that even though the frontline workers were losing their own family, they still showed up to work and did what they could for their team by being present and doing what they could to save lives. He made himself very present in the eyes of the Northwell employees and visited Northwell hospitals almost every day, providing support and evolving information about where the system stood with the battle against the coronavirus. Creating a strong culture of care with the 23 hospitals of the Northwell Health System represents Dowling's transformational leadership style. Dowling created change and guided his fellow team members to work together in a time of crisis and transform the workflow of each hospital in order to reach a common goal: caring for as many people as they could safely and effectively. Michael also represents the strategic leadership theory, as he had to rethink how to assign and delegate to his leaders how they could facilitate creating more space for beds, all while ensuring there was adequate supply and equipment at hand in order to safely take care of the overflowing amounts of patients coming through their doors. With his creative strategizing, Michael created 200 new hospital beds every night for a week by reconfiguring hospital conference rooms. Lastly, and most importantly, Dowling's charisma as a leader shined through when he went directly to the front lines and showed his gratitude to his healthcare workers. He would visit intensive care units and do walkthroughs to interact with staff and let them know that he was there for them, and he had their support in return. He explained that he did not want to sit in his office and issue dictates, that if he wanted to send his workers to the trenches, he would have to have the courage to go there with them. He has a great way of interacting with those who work for his health system, and to be able to converse with them on the front lines and not just be a depiction speaks volumes to who Michael Dowling is as a leader, especially in a time of crisis.
The effects of the pandemic are still being felt and will continue to have a significant impact on the healthcare industry. The Northwell Health System can use a number of strategies to prevent the spread of any potential threats in the future, including implementing telehealth earlier on to avoid stopping all non-emergency services. This will facilitate contact with healthcare professionals while also reducing the inevitable physician shortage. Telehealth monitoring and support for patients recovering from COVID-19 after being discharged from the hospital would also be valuable in order to lessen the overflow of patients in hospitals. Implementing this would reduce the likelihood of burnout among medical professionals since they would have greater support. The pandemic has also provided us with invaluable lessons through the challenges and triumphs of recent years, the value of employee empowerment being one of the most important ones. In his book, Dowling stresses the significance of leaders going to the front lines to encourage their team and calm their fears. Dowling was at the forefront of Northwell's system, visiting the hospital every day to offer support and encouragement, despite being 71 years old and regarded as a high risk. It is crucial to show gratitude to healthcare professionals and let them know how much their sacrifices and commitment are appreciated, now more than ever. Northwell was able to effectively respond to the pandemic due to Dowling's incorporation of a transformative and strategic leadership style. As we've learned throughout this course, a CEO cannot operate an effective organization alone. They must take into account the demands of their workforce in order to maintain a successful system. And during this unprecedented time, providers needed support, resources, and reassurance to continue moving forward. To fulfill the organization's objective of improving health and quality of life of the communities we serve through world-class service and patient-centered care, these methods must be put into place. Only with the right support and procedures in place for staff can this be accomplished. By doing so, Northwell improves patient care while also assisting staff members in building their resilience. While it was impossible to predict the pandemic's impacts on the world, let alone the healthcare systems, Northwell Health Systems did the best it could by implementing its emergency management strategies into action. Through Dowling's previous planning for emergency scenarios, Northwell Health Systems was able to perform the best compared to other systems throughout the country. Dowling had an obligation to provide his team with appropriate leadership and assistance as the executive of a health system that employs more than 75,000 people and cared for the majority of COVID-19 patients. The answer in a situation like this, according to Dowling, is to maintain composure, optimism, a can-do mentality, and extreme organization. You need to be able to inspire your team members, constantly connect with them, provide them with analysis and updates, and instill confidence in them.